Could you discuss what you believe are the main sources of resistance to providing HCV treatment to everyone? And what lines of argument do you think would be most likely to overcome that resistance?
There's been an enormous amount of hand-waving and hand-wringing about the dollar figures of costs of hepatitis C treatment because people are multiplying the cost of the treatment now times the number of people that are possibly infected and projecting that those costs will all happen this year. So all 3 to 5 million people are going to be treated this year, and that's just completely unreasonable. We've never treated more than 120,000 people in a year in the past. So at the present rate, at that rate of treatment, it'll take us 40 years to treat the number of people that we have with hepatitis C. Hopefully the numbers will increase, and hopefully we'll do better. Not only that, but as the number of new drugs hits the market in late 2014 and early 15, price competition will undoubtedly bring the price down, for these patients. It's also economically, for the long term, it's incredibly cost effective to treat these patients. The cost of dying of liver disease, cost of liver transplant are about $500,000. So if you actually are thinking long term, as most of us should be, unfortunately, most of our private insurers are not. They're thinking either quarterly cost and earnings, or actually with a 2.5-year time horizon, because that's the average time Americans spend on health insurance. Then they're thinking, we just don't want to put out the dollars now, and hoping these patients will die on somebody else's dime. Whereas that's really short-term thinking, for the whole U.S. So in fact, we can't possibly treat everybody now. It's going to take many years. Hopefully we can do it in 10, not 40, and before they get sick and they die, because it's really cost-effective to do that. I think the only complainers really are the health insurers, who were surprised seemingly by this cost, and it's cutting into their profits.